available and allocated £55.5 million to boards in 23-24 to improve mental health and neurodevelopmental services.
Edward Mountain.
Well, Presiding Officer, if that's an answer, I don't know what I am doing in this Parliament. Let me help the Cabinet, the Minister. There's 24,096 children on NDAS waiting lists. In fact, some people don't even have, some NHS and councils don't even have waiting lists. But Ayrshire and Arran are saying that it's going to take 19 years and 3 months to clear their NDAS waiting list. Now, in the Highlands, as I said, the council doesn't have a list. NHS Highland doesn't have a list. Will the government at least tell them to get a list drawn up so we know how many children actually need help?
Minister.
I can assure the member that we're working with all NHS boards, including NHS Highland, to improve neurodevelopmental support and pathways, and we're working with local authorities to ensure that the support is there for children and young people, regardless of whether they have a diagnosis or not. As well as the investments to health boards, we've provided over £1 million in recent years to the Fund 5 neurodevelopmental tests of change, including one in Highland. They are focused on implementing the ND specification, including delivery of GIRFIC and multi-agency working, and we will continue to support health boards and local authorities to work together in line with the specification to ensure that the support is there for children who need it.
Question number 5, Russell Finlay.
To ask the Scottish Government whether it has any plans to revise the terms of reference that is set for the Scottish Child Abuse Inquiry.
Minister Natalie Dawn.
There are currently no plans to amend the remit of the Scottish Child Abuse Inquiry. Questions about the scope of the inquiry in relation to non-residential settings has been raised previously, and ministers have made clear the need for the inquiry to focus on its current and wide-ranging terms of reference, centred on the abuse of children within institutions which had legal responsibility for the long-term care of children. Widening the remit of the inquiry to include abuse in non-residential settings would result in it taking much longer to respond to the survivors of abuse in care.
Russell Finlay.
Thank you. There are two classes of child abuse victims in Scotland, those who are heard by the inquiry and those who are not. Victims like Susie Henderson, whose childhood was destroyed by a legal establishment paedophile ring, and victims like Peter Haynes and Stuart McMillan, whose childhoods were destroyed by industrial-scale abuse in Scottish football. They and many others simply don't understand why the inquiry is closed to them. They've also been fed misinformation from this government. Last year, Nicola Sturgeon told me the inquiry's remit is a matter for the inquiry. This is not true. I've asked ministers to widen the inquiry's remit, but they continually refuse. So today, again, I urge the Minister to do the right thing by these victims, and will her government please think again?
Minister.
I want to make really clear that our sympathies are absolutely with all victims of historical abuse. However, as the member knows, and as I've just reiterated, the Scottish Child Abuse Inquiry was set up under the Inquiries Act 2005 to investigate the abuse of children in care in Scotland, following a call over many years from survivors of in-care abuse. Now, ministers have made clear the need for the inquiry to focus on its current and wide-ranging terms. While we, the Scottish Ministers, set the terms of reference for the inquiry, thereafter it has been the responsibility of Lady Smith, Chair of the inquiry, to decide on what is considered as part of the inquiry, and we are fully committed to maintaining the inquiry's independence from the Government. In terms of investigation and prosecution of those guilty of abuse, this would remain a matter for Police Scotland and the courts.
Question number 6, Colin Smith.
Thank you, Presiding Officer. To ask the Scottish Government what its response is to reported calls for a moratorium on the closure of publicly owned care homes.
Minister Marie Todd.
No one wants to see the closure of good quality care homes, and I understand the concern that this causes for residents and for their families. Regrettably, there will be situations where local authority-run care homes close for various reasons, and although we have overall responsibility for health and social care policy in Scotland, the statutory responsibility for delivering these services are for integration authorities to make in consultation with people who use those services and in full awareness of the impact on them. It wouldn't be appropriate for the Scottish Government to directly